Patients often complain that when they have a cold, the symptoms seem to worsen over time. For example, they may initially have a fever, but once the fever subsides, they experience coughing and a runny nose. Initially, it might be coughing and a runny nose, but later on, they may develop diarrhea or gastroenteritis, the viruses that cause colds number over 100, including common ones like rhinovirus, coronaviruses, respiratory syncytial virus, parainfluenza viruses, influenza viruses, adenoviruses, and mycoplasma. Among others, different viruses lead to different symptoms, making the manifestations of a cold highly variable. For instance, in the case of influenza, early symptoms often involve body aches, headaches, or fever, with nasal congestion, runny nose, and cough appearing later. With adenovirus, symptoms range from a runny nose and cough to fever, diarrhea, and rashes. Therefore, experiencing different symptoms at different times is a normal phenomenon, and it requires an experienced physician to adjust medications accordingly. Is it necessary to take antibiotics for a cold? The primary approach to treating a cold is symptom management, as colds are typically caused by viruses and antibiotics are not necessary. However, the nasal and oral cavities of healthy individuals naturally harbor bacteria. When a cold virus invades and weakens the immune system, these resident bacteria can become uncontrolled and invade tissues, leading to conditions such as middle ear infections or even pneumonia. Therefore, an experienced physician may prescribe antibiotics when necessary to treat symptoms associated with secondary bacterial infections. The treatment duration is usually 1-2 weeks, and it is essential not to self-discontinue medication to avoid developing antibiotic resistance. Having a physician oversee the treatment also helps prevent harm to the body from medication.